I'm a fellowship trained breast surgical oncologist, and someone recently commented on one of my videos that they had a breast biopsy done and they learned the grade from looking at the pathology report, but no one told them the stage and they had to ask. And this is why. This is the 8th edition of the AJCC prognostic stage groups. This is the clinical prognostic stage. And this is the new chart we use in order to determine breast cancer stage. Now, grade is what the cancer looks like under the microscope. Is it slow growing or grade 1? Is it in between, grade 2, or is it fast growing or grade 3? Stage is information including the grades that's in this column right here, G1, G2, G3. The receptor status, if the patient's cancer has estrogen receptors, progesterone receptors, or if it has HER2 receptors, as well as how big the cancer is and if it's spread to the lymph nodes. Here's a zoomed in view of that chart, and you can see looking at this column here, this is looking at anyone who has less than a 2 centimeter tumor, who has less than 2 millimeters of cancer in a lymph node, or no cancer in a lymph node, and no cancer anywhere else in the body. That's what the M0 means. Here, the next column, you can see we have the grade again, and then you have the receptors starting with the HER2 receptor. And then you have the estrogen receptor, whether or not the patient's cancer has those, the progesterone receptor, and in the last column, it shows you what the stage is based on that information. In the past, we used to do breast cancer staging just looking at the size of the tumor as well as whether or not the lymph nodes were involved. Now we have so much more data that tells us that the type of cancer it is and how fast or slow growing it is based on the grade makes a difference as well. So sometimes it can be a little bit more complicated calculating the stage as a result. But someone on your treatment team, either your surgeon, your medical oncologist, your nurse navigator, should be able to give you that information at your first visit. And I totally agree with this comment that if no one gives you this information, you should ask.